Hi Kaylee, my name's Alyssa. I'm going to be your student physical therapist today. Is it okay if I work with you? Alrighty, so today what I'm going to be doing is I'm going to be testing your sense of smell. I ask you to close your eyes for me, and I want you to cover your right nostril. I have a common scent that you would smell in your house. I'm going to waft it under your nose, and I want you to tell me what you smell.
Citrus.
Alrighty. Keep your eyes closed, and I want you to do the other nostril for me. Tell me what you smell.
Minty.
Alright. I ask you to look at the chart, cover your left eye, and I want you to read the lowest level that you can, okay?
PECOLCFT.
Alright, now cover your other eye and read it backwards.
DTFCLGZEP.
Okay, so now what I'm gonna do is I'm gonna have my hands behind your head, and I want you to tell me when you can see my fingers on both sides.
Both.
Alrighty, which one's wiggling?
This one. This one. Both.
Alrighty, we're gonna do the same thing, go from top to bottom. Let me know when you see them.
Both.
Which one's wiggling?
This one. This one. Both.
Alrighty, peripherals. Which one's wiggling?
This one. This one. This one. Both.
Okay. And then what I'm gonna have you do is I'm gonna have you cover this eye. And then let me know when you can see my finger.
Now.
Is it wiggling?
Yes.
Alright, we're gonna do the same thing on the other eye. Let me know when
Now.
is it wiggling?
Yes.
Okay. Now what I'm gonna have you do is I'm gonna shine this light in your eye and I'm just gonna check your pupillary constriction. Alrighty. I'm just looking for a direct response when I shine the light in your eye, and then a consensual response in the other one. Okay? And then can you stick your tongue out for me and say ah? Alrighty. Can you stick your tongue out again and and then go do this? Awesome. And then also I'm gonna ask you to do is I'm gonna ask you to look at the tip of my pen and you're gonna follow it. Okay? The tip of this pen with just your eyes, okay? Alright, good job. I'm gonna ask you to go back and forth between this finger and this finger. So whenever you're ready, just start. Alright, now we're gonna do top to bottom. Okay, so we're going to be testing your sensation on your face. Is it okay if I touch your face first and foremost? I want you to close your eyes for me, and this is what it's going to feel like. I want you to tell me if you feel it. So you're just going to say yes.
Yes. Yes. Yes. Yes. Yes. Yes.
Alrighty, now I want you to tell me yes if it feels equal in pressure. Did that feel equal and you felt it on both sides? Yes. Alright, so now you're going to tell me yes if you feel it.
Yes. Yes. Yes.
Alrighty, so now what we're gonna do is we're gonna do what's called a sharp and dull test. I'm gonna sanitize it real quickly. And so we're gonna be using a safety pin for this test. Can I have your hand? I'm gonna show you what it feels like first. So this is sharp, this is dull. And so I'm gonna apply this on your face and you're just gonna tell me yes, or you're gonna tell me if you feel sharp or if you feel dull, okay? And then your eyes are closed.
Dull. Sharp. Dull. Sharp. 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 Dull. 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 Sharp. Dull.
What I'm going to be testing next is your jaw reflex. First and foremost, do you have any jaw problems? Alright, and it's okay if I touch your face again. Alright, so can you just relax your jaw onto my hand? I'm just going to be tapping this hammer on my thumb. Good job. And so I'm going to touch your face again. What I want you to do is I'm going to apply some pressure downward. I don't want you to let your mouth open, okay? So, ready? 4, 5. Alright, now can you open your jaw for me? And I'm going to push up and try to close it. Don't let me close it, okay? 2, 3, 4, 5. Good job. I want you to clench your jaw. I'm going to touch your face again. Is that okay? Alright, so just clench your jaw. Relax. Clench your jaw again. Relax. Clench your jaw again. Alright. What I'm going to do is I'm going to have you close your eyes and I'm just going to try to open them. Don't let me open them, okay? Okay? Alrighty. So now, can you smile for me? Can you frown? Can you make a bubble? Can you look surprised? Can you look mad? Good job. Alright, Kaylee, we're going to be testing your taste on your tongue. So what I'm going to have you do is close your eyes and stick your tongue out. And I want you to tell me what you taste.
All.
Salt? Alrighty. And then for this one, you're doing great on not sticking your tongue back in. in. Just keep it up. And what do you taste?
Boom.
Okay. You can stick your tongue back in. All right. Keep your eyes closed. Stick your tongue out. Make sure after I put the substance on your tongue, do not move it back in. What do you taste?
Oh.
Alrighty. You can bring your tongue back in for this one. And whenever you're ready, stick your tongue back in. Alrighty. What do you taste?
Ooh. Okay.
I'm going to be testing your hearing, so what I want you to do is I want you to close your eyes, and I want you to tell me if you hear the sound on one ear, the other ear, or both ears, okay?
Both. Left. Right.
Alrighty. Did they sound equal? Alrighty. Close your eyes again. Tell me if you hear this better on one or two.
One.
Alrighty. You hear this better on three or four?
Three.
Okay, close your eyes. Do you hear this equally on both sides?
Yes.
So now what I'm going to do is I'm going to be testing your eyes again. So is it okay if I touch your face? So I'm just going to tilt your head down just a little bit towards me. And I'm just going to shake your head side to side. Just focus on my nose, okay? And then tell me if you have dizziness or blurry vision, okay? How you doing? Alright. Feeling okay? Alright. Alright, okay, so we're going to be testing your balance. Is it okay if I touch your face? So what I'm going to have you do is I'm going to have you turn towards me just a little bit. I'm just going to support you right here on the back of your head, and then right here where your other head is at. And then what I want you to do is you can use my arm and just use that as a support. We are going to go down pretty quickly. So on the count of three, we're going to go down. Okay, ready? 1, 2, 3. And just be sure to not look at me specifically. You can look everywhere if you want to. Just don't focus on one spot. Just relax.
Okay, you're good.
Alrighty, you doing okay?
Mm-hmm.
You feel fine?
Yes.
Alright, so we're gonna do the same thing on this side. Can I have you turn facing towards me? You can, again, hold my arm for support if you need to. We are gonna go down quickly. Same thing applies. Don't look directly at one point or at me. You can look around. Ready? 1, 2, 3. You doing okay?
Mm-hmm.
Alright. You doing okay?
Mm-hmm.
Still doing fine?
Yeah.
Alright, we're gonna go up. 1, 2, 3. Alright, you feeling okay? Any dizziness, blurriness? Alright. So take a sip of water. I am gonna put my hands on your throat. Is that okay with you? Alright, so whenever you're ready, just take a sip of water. Alright, good job. Okay, so I'm gonna be testing your head and neck muscles. Is it okay if I touch your shoulders real quick? Alright, so all I want you to do is I want you to raise this shoulder for me. I'm gonna apply some pressure. Don't let me move you. On this one. Don't let me move you. Shrug your shoulders. Don't let me move you. Alrighty, I want you to turn this way. Is it okay if I touch your face? Alright, I'm just gonna turn it out just a little bit. Don't let me move you. Alrighty, turn that way. Don't let me move you. Okay, so I'm just gonna ask you to say a simple sentence like, I go to UMHB.
I go to UMHB.
Cool. Cranial nerve 1 abnormalities to note would be if my patient was unable to detect a smell or my patient gave me the wrong smell. For cranial nerve 2, abnormalities would be if my patient was unable to read the Snellen chart from 10 feet away or read it incorrectly. Another one would be if my patient was unable to see my fingers from her peripherals or she didn't see them at the same time. For cranial nerves 3, 4, and 6, some abnormalities to note would be if my patient was having a droopy eyelid, if my patient was not giving me a direct or consensual response when shining the light in her eyes, if my patient was also presenting with overshoot or undershoot when asking to look from one finger to the next as fast as possible, and another abnormality to note would be if my patient was unable to do smooth pursuits, so you could see their eyes jumping instead of creating a smooth transition from one side to the next. Another abnormality to note would be if my patient was unable to perform the H test And I would also notice any nystagmus. Cranial nerve 5, or trigeminal nerve, some abnormalities to note would be if my patient was unable to feel light, sharp, or dull touch on her 3 areas of her face. Another abnormality to note would be if my patient was unable to open or close their jaw against resistance, and if I was feeling some asymmetric tone in their masseter muscle. Another abnormality to note would be if my patient lacked jaw jerk reflex. For cranial nerve 7, some abnormalities to note would be if my patient was unable to properly identify the sweet or salt taste on her tongue. And then also another abnormality would be asymmetry from one side of the face to the other when asking to do facial expressions such as smiling, frowning, making a bubble, raising her eyebrows, and frowning them as well. For cranial nerve 8, abnormalities to note would be if my patient was telling me any dizziness or blurry vision, or if I was noticing nystagmus when testing her vestibular-ocular reflex. Another abnormality to note in the Dix-Hallpike test would be the nystagmus as well. For assessing her vestibular portion of the nerve, abnormalities to note would be if my patient was unable to hear me rustling her fingers equally and bilaterally on both of her ears, and then also if she was telling me the tuning fork sounded louder on her bone compared to her ear, and if she could not hear the tuning fork equally and bilaterally when putting the tuning fork on her head. For cranial nerve 10, abnormalities to note would be if my patient had experienced coughing or choking when swallowing the water, or if I had felt asymmetry when touching her throat as she was swallowing. Other abnormalities to note would be when my patient said "ah," I was hearing hoarseness or a nasal sound, and then also if I had noticed any asymmetric elevation of her soft palate and uvula. For cranial nerve 11, abnormalities would be if my patient was unable to resist me when assessing her sternocleidomastoid strength and her upper trap strength. For cranial nerve 12, abnormalities that I'm looking out for is an immediate deviation of the tongue to one side, an inability to rapidly move the tongue from one side to the next, or dysarthria throughout the entire assessment.